A warning that our next report deals with an issue that some viewers may find distressing. Universities have been asked to adopt the University Mental Health Charter framework by September 2024. This request came during a parliamentary debate at the start of June after a petition by Campaign Group for the 100 called for universities to have a legal duty of care towards students. Currently, universities bear no statutory obligation to offer duty of care to their students. Well, earlier in the week, I spoke to Rachael Swann, who is a UK leader in suicide prevention and the CEO of the charity Grassroots Suicide Prevention.
You know, 1 in 5 of us will suffer with suicidal thoughts at some point during our lives. That could be you, me, anybody. And we know that when people reach the point of crisis, they want their pain to end, but not their lives. And there's often a whole range of reasons, issues and struggles to why somebody has reached that point of crisis. It could be bullied at school, it could be a marital breakdown, there could be domestic abuse, it could be a mental health condition, although when we talk about suicide, we're not just talking around mental health conditions, diagnosed conditions. We know that middle-aged men are still at the highest risk, but it's now the biggest killer of the under 35s, and the rates in women are rising. So, you know, you spoke about the petition, and there's been, you know, an increase in rates within universities. So we really need to do more and take action now.
And this petition started by a group of parents whose children had killed themselves, died by suicide whilst at university. They are calling for a legal duty of care towards the students. How important is that?
Raising this petition and raising awareness is amazing for suicide prevention and getting people to reach out for support. What I would say is that there needs to be a really in-depth investigation of all of those deaths by suicide, and looking at how then we move forward. I know the minister's called for universities to sign up to the Mental Health Charter. I think that's good in some ways, but it does not go far enough. You know, the Mental Health Charter doesn't include suicide prevention.
What are some of the critical things that you want people out there to know when it comes to suicide prevention?
I think really learn about the causes and risks, and think through and learn about the myths. So, for example, there's a really big myth to say that if you talk to somebody openly about suicide, you might give them the idea. So there's a huge amount of stigma. It's really important that you learn about suicide, go on the Suicide Prevention Hub, look at the Real Talk film, download the Stay Alive app, learn about suicide so that you can, at any point, if you can identify if someone's struggling, you understand if someone what they're saying is out of line, their behaviour has changed, their mood has changed, and you can really then have that conversation right at that moment.
Is the government doing enough to tackle the issue, to make sure that there are safeguards in place? I mean, you've got this university petition and the parents calling on the government to make it a legal duty for universities, but what else needs to be being done that's not being done?
There's been a lot of debate about a national suicide prevention strategy. We are expecting that over the summer. We absolutely need that strategy coming off the table so that in every locality they can then develop local-based action plans. We're involved in a lot of that work in terms of helping develop that strategy, help build local action plans, and it means that all stakeholders and the general public can really understand what they can do and the part that they can play in supporting people at risk.
And Rachael, just to finish, I want to ask you, for anyone out there, you've addressed some of the ways that you do approach this very difficult subject with compassion, with empathy. We've talked about some of the misconceptions. So I want to finish on, for anyone out there who might have someone that they're concerned about or worried about, what are some of the signs perhaps that you should look out for, or when would you recommend having that type of a discussion with someone that you're worried might be at risk?
I would absolutely be having that conversation straight away. So if you're concerned about anybody, create that safe space, learn out how to have that conversation, and think through, think about the signs. So actually, if somebody's saying, I've really had enough, I can't take any more, or if you see behaviour change where somebody is normally very outgoing and actually they've really gone within themselves and they've become isolated, really look at all those different signs. And you can learn all about that on our Suicide Prevention Hub. But the main thing is being empathetic and compassionate, and really don't be afraid to ask about suicide. And anybody who's struggling, please reach out for support.
And for anyone out there struggling with their mental health, please do reach out and seek help, either via the NHS or you can go to samaritans.org. They have support available 24 hours a day, 365 days a year. You can also access free resources on the Stay Alive app that's developed by Grassroots Suicide Prevention, and it has links directly to local and national crisis resources in your area.